Coming back to being one of the safest vaccines, this is safe enough for my mother to take, and she has taken it, and I have taken it, and that's my real ultimate comment on safety. If it's safe enough for my family, I think it's safe enough for everyone.
Little more than a year ago, public health officials in our region were closely monitoring the global spread of a novel coronavirus and the resulting illness known as COVID-19. Since that time, nearly 750,000 cases have been reported across the state of Tennessee, and tragically, more than 10,000 Tennesseans have lost their lives to this illness. Fast forward to today, when nearly 1.5 million Americans per day are receiving doses of a vaccine that will hopefully put an end to one of the worst public health crises in more than a century. We once again visited Director Gary Mays and Dr. Stephen May with the Sullivan County Regional Health Department to learn more about these vaccines and what they mean for the prognosis of the pandemic here in our region. So, Dr. May, what have recipients of either of the vaccines that are currently available typically experienced in terms of side effects or symptoms following either their first or second dose?
Well, they're usually the typical side effects that we see with many of our vaccines. So low-grade fever, headache, fatigue, malaise, myalgias are all very common, can feel pretty yucky. Of course, soreness at the injection site has been pretty marked, and sometimes we see an occasionally swelled up lymph node that becomes tender, but all that is expected and really indicates that your body is making a robust immune response to the vaccine.
Based on the body of research thus far, what level of effectiveness or protection from the coronavirus can recipients expect following each of the doses?
Well, with the first dose, that's really just a priming dose. Where you get your real immunity is with the second dose. So that second dose is most important. And we know that about 2 weeks after the second dose, we see the highest levels of efficacy or disease reduction by about 95% with the original strains that we were dealing with. We're starting to see a couple of other strains, but even then, the efficacy is still in the high 70s, 80%.
Following that second dose of the vaccine, can recipients then feel free to ease up on some of the restrictions we've been under, be it mask wearing, social distancing? Does that second dose give them that level of confidence that they don't have to worry about spreading the disease anymore?
Well, that's a question we haven't answered scientifically yet. We do know that it reduces hospitalizations, death, and disease, actual physical disease, but does it prevent infection and disease transmission? That is still being looked at and researched. So it is still important that we maintain safe distancing, social distancing, and that we maintain our mask wearing and safety precautions we've been practicing all along. I think those answers will come in time, but for right now, with the advent of disease and the severity of the level of disease that we have seen, we need to carry on with those safety measures.
Can I contract the actual COVID-19 illness by receiving the vaccine?
No, you cannot. The way this vaccine is designed is you're only getting a very small piece of the messenger RNA that's encapsulated in a, I want to call it a little fat bubble. It's encapsulated in a little lipid bubble, and that is all you are receiving. And with that, it cannot do anything. The way this vaccine works is it tricks your body into making one of the proteins that our immune cells need to recognize to form immunity. And so we just make a few of those protein molecules that turns on the immune system, and that's all it is. There is no whole virus or or even a substantial part of that virus that is contained within that vaccine.
There have been a significant number of, we'll call them opinions, shared on social media and elsewhere regarding the safety of these vaccines. Now, those range anywhere from concern about the speed at which the vaccines were developed and released to theories about them containing microchips to track our movements. What would you say to individuals who have concerns about whether or not it's safe to receive the vaccine?
Well, first I can tell you that it is a very, very safe vaccine, one of the safest vaccines that have ever been developed. When we look at the penicillin allergic reaction, it's 50 per 10,000. We're looking at 11 per million allergic reactions that we see to this. So it is even safer than getting penicillin. As far as does it have anything else in it, as far as alien technology and tracking devices and all that, we do not have any of that type of technology available. Just developing this vaccine has been miraculous. Now, going back to the vaccine development, this vaccine went through all the normal phases that we do for any vaccine, so there were no short steps taken. It's just that certain steps were conducted in conjunction with each other. And normally, for us to get enough people for a phase 3 study, 35,000 people, takes us years in developing a vaccine. But in this case, we were able to get the volunteers very quickly, analyze the study. This has also been one of the most transparent studies that utilizing a new vaccine that's ever been published. So, and we continue to monitor through the vaccine adverse event a monitoring system. We continue to monitor all across the United States and the world to look at side effects and possible complications. As far as I'm concerned, it is a miracle that we've been able to develop it this fast. I have not seen any shortcuts whatsoever. We've given here probably 15,000 doses without any major reactions. Now, we do see the typical side effects, and I will warn people the second dose tends to be a little worse than the first dose for the typical side effects that we see with the vaccine. But giving it here in mass clinics, that has never been done before. We've never, in our history that I was aware of, done drive-by clinics. We've just done them a couple of years, maybe with flu vaccines. But for us to accomplish this and get a vaccine safe enough to give in a mass drive-by clinic is truly amazing.
So, Gary, vaccine rollout plans vary somewhat from one state to another. Can you give us some insight into how Sullivan County and the state of Tennessee developed their plan for who to give the vaccine to and when?
Well, I think Tennessee has really done a nice job planning with vaccine. And I think Tennessee has a solid plan because they started many months ahead of time working on the vaccine plan. Now, as with any plan, execution is very important. And so the more planning you have, the better your execution. The problem that we are having, along with the other 50 states, is the supply of vaccine. So while the plan may be solid and even well-intended, if you don't have vaccine, the plans really don't mean much. You've got to have a product to deliver. So since the Christmas week, we have been administering vaccine in Sullivan County, and our allocations are based on the size of our population in the county. So there have been times that we have ran out of first dose vaccine and none to take its place for that week until the next week's allocation comes in. So that creates a lot of frustration with the public, and understandably. It creates a lot of frustration for those of us involved in it. But I think Tennessee's plan is solid. It's been recognized among the other 50 states as one of the best plans in the state in terms of the quality and how it treats Tennesseans across the state fairly. And I think if we had vaccine supply, that Tennessee would be a leader in the 50 states.
There are currently vaccines available from 2 primary manufacturers. Which vaccine is being distributed by the health department now?
Currently, you're correct. The only 2 approved vaccines for distribution to the public is a brand name of Pfizer, and the other brand name is Moderna. And we have been administering both in Sullivan County, along with the Northeast Regional Health Office, who is also administering both. We're anxiously waiting to see what the approval and emergency use authorization will be for the other 2 companies that are in phase 3 clinical trial. So we'll look at that. I'm sure Tennessee will be giving that a close look along with CDC. If those companies gain approval, certainly we're very open to having additional vaccine in Sullivan County. So I think it's fair to say at this point that if there is vaccine that is safe and effective and approved, properly approved, that we will be administering it in Sullivan County.
Bristol, as you mentioned, has gained quite a bit of attention along with the rest of Tennessee for the vaccine distribution point, specifically the one located at the Bristol Dragway that we have here. How did that partnership come about?
Well, all along, Bristol Motor Speedway has been very supportive and in close communication with us at Sullivan County Regional Health Department during this pandemic. And they've been partnering with us and helping us get the messaging out about the safety protocols, about safety guidelines, being safe in our community. So it was a long established relationship that we've had. And realizing when the demand for vaccine would be very, very high, our planning group and our internal planning group at Sullivan County Regional Health Department done their homework, and the employees here at the health department, and they suggested that we reach out to Bristol Motor Speedway, and that was all it took, was just a simple phone call. The Bristol Motor Speedway was very excited to participate, and I must say, just been an excellent partner and assisted us in every way to facilitate administering vaccine. And it has worked well for the public. It's worked well for our team and our staff internally, and it's serving us well. For an example, yesterday we gave over 1,400 doses just at the Bristol Motor Speedway. And in Sullivan County yesterday, we just gave under 1,900 doses in one day. So Bristol Motor Speedway is a true gem that we are blessed to have in Sullivan County and get to use it this way. It means a lot to us. It means a lot to the people of Sullivan County and this region. It has gotten a lot of notoriety, mostly because of the sheer volume of throughput that we have in administering vaccine, and of course the notoriety of using a national sporting venue for public good is something that needs to be spread throughout the country. It's been on national news, and so we're very grateful that we have this facility, and certainly very grateful for the officials at Bristol Motor Speedway.
It's my understanding that vaccination rates here in Sullivan County and Northeast Tennessee in general are outpacing the rest of the state. So demand here is obviously quite high. What is the biggest challenge that you all are facing in meeting that demand?
Well, quite simply, the biggest obstacle is vaccine supply. And that is true. Our demand in Northeast Tennessee is very high. We're very grateful for that. And I think people in Sullivan County, Bristol, and Kingsport, they just want out of the pandemic, and as much as we do. And folks want to do the right thing in Northeast Tennessee, and it's a great community. And so people pull together. And so I think that's why you see this region interested in taking the vaccine. They want the pandemic over with. They want to get back to their normal lives, and people in this region pull together and we work together. So a lot of problems could be solved if we had vaccine. So I'm still optimistic that we will get there. Surely, as long as we can administer 1,900 doses a day and keep at that pace, we will eventually get there and blunt this virus and be out of the pandemic phase.
It was reported this week that as of February 1st, more Americans had received one or both doses of the vaccine than the number of total individuals who've tested positive for COVID-19. That certainly feels like we've hit an inflection point as a nation. How does that fact make you feel as a public health official?
Well, it gives us hope. A year ago, last week, was when we began responding to what was more commonly called coronavirus in January of 2020. And then, of course, the name changed to more commonly known COVID-19. But in January of last year, we had very few tools. We had no information. It's a novel virus. We knew nothing about it. We didn't know how it spread very well. We didn't know anything in January. Then by February, March, a little more information came about, and the only tools we had was social distancing, wearing a mask, and quarantine and isolation. And we've been using those tools since last February, March of last year. And I vividly remember if we could only have a safe and effective vaccine. And so now we do. So the vaccine gives us hope that we can at least get out of the pandemic phase and save people's lives, because this is life-saving vaccine, especially those that are vulnerable. And so that's who's getting it first in throughout the state. And so we support that effort, and we believe the vaccine is very effective. Clinical trials tell us it's very safe. And so our mission is to get all the vaccine that we can as quickly as we can into as many that want it. And so as long as we continue doing that, we'll get out of this.
Is there anything else you would like to add from your perspective to this discussion about the vaccine and where we are and looking forward?
Well, certainly we hope that vaccine supply cadence picks up from where we are. I really do hope that we can receive larger and larger allocations. We really want our community partners, other pharmacies, other medical providers, other facilities that can administer vaccine safely. We want them to be able to administer vaccine and so eventually reach a large proportion of population in this region. And so that will make it safer and healthier for us in terms of the pandemic. But the pandemic has brought so much tragedy to us, our friends and our families. We've lost friends and family members in this pandemic, and jobs has been immeasurable. It's unbelievable how this pandemic has transformed our region and impacted our region so negatively. But I look over the last year and how this region's pulled together, and the people in Sullivan County have pulled together, the way our mayors of the city of Bristol, Kingsport, and Bluff City and Sullivan County work together. They've stayed together. They've communicated well among themselves. They've led us in terms of policy and actions that we need to be taken in public health. And I also like to mention our school systems. Our three public education systems have been working together as much as possible to provide education in a safe way for their staff and students. And the man hours that they have put together working with us in the state has been immeasurable, and they're totally committed to keeping our schools safe and working with our children. It's been extremely difficult, and the pain that we've had to bear in this region is just unbelievable. But I see a community that's really pulled together, and I see people that are anxious to do the right thing, and I see a community that I believe is going to pull together, and we're going to get out of this pandemic, I hope, in a few months, and it will be an exciting time. So when I look back of all the tragedy and all the bad things that have happened, we'll never forget that. But I also see the spirit of what our elected officials have put together, and the way they behave and the way they make decisions for the public good, I think is pretty outstanding.
Since January 7th, 2021, Bristol Dragway, often referred to as Thunder Valley, has been serving as a veritable vaccine valley and one of the largest points of distribution for the COVID-19 vaccine in our region. Sullivan County Regional Health Department's Emergency Response Coordinator Mark Moody tells us more about what it takes to run this impressive operation.
First, they would enter the drag strip off of 394. They'll go down an access road to Copperhead Road. There they will be met with a volunteer or a team member for Sullivan County Health Department, and they will be asked if they're here for first dose or second dose. For first dose recipients, we put a little colored dot on their windshield. Then they come on over Copperhead Road down to the area where we separate the traffic into first dose and second dose. First dose will then come out and take the left-hand side of the drag strip. That's the first dose line. Second dose will turn right and go up a little ways and cut across the drag strip and come down the other side for second dose. First dose does take a little bit more time because people have to complete the vaccine encounter form. It is on our webpage, so if folks want to go to that and download it and fill it out and bring it with them, that helps speed up the process. Second dose, we already have those, so you just pull up, give us your name and so forth, and we pull your form out, give it to you, and you then come down to the vaccination area, which is these 3 tents down here. The 2 tent side is first dose side, the 1 tent side is second dose side. After they get vaccinated, they pull over to the behind the grandstands from light pole 1 through 4 and set for their 15-minute observation unless they have documented severe reaction to vaccines in the past, and then we keep them 30 minutes. It's staffed by Dr. Spivey, who is a ED physician and has been volunteering his efforts to help out Dr. May, the medical director of the department, as well as an ambulance on site from Bristol, Tennessee Fire Rescue with paramedics or advanced EMTs, as well as several MRC volunteer retired physicians and nurses. Now, you do have some waits in line, but that's pretty much standard across the nation. People are going to have to wait in line some. There's really no reason to come out here at 2 a.m. in the morning and get in line. Folks still do that, but that means you're sitting in line already for several hours because we don't open and start flowing traffic till between 8:30 and 9 o'clock. The vaccine prep, right now we're using Pfizer. That's what we're getting allocated by the state. And that process is about a 45-minute process to get the vaccine ready to put in draw it up in a syringe with a needle that we can vaccinate with. So we get started, as I said, somewhere between 8:30 and 9 o'clock. And then, traffic moves. But there is a wait, but this is absolutely a fabulous venue, unlike anything else in Northeast Tennessee, to be able to handle this volume of traffic. We've had some challenges with staffing, but our Medical Reserve Corps, the volunteer fire departments in the county have all come through for us, and we've had 15, 20, 30 MRC volunteers, as well as 8 to 10 volunteer fire departments out here. We use those individuals to help us direct traffic. We use them, those that are paramedics. They can help vaccinate. We also have a contingent of the National Guard here. There's 4 members. There's 2 that we use primarily for traffic direction, 1 that we use in an administrative capacity in the second dose tent, and then 1 is a medic, and he helps do vaccinations. We have given, I think our biggest day was about almost 1,600 first and second doses. We've given the high 800, 875, almost 900 first doses on an occasion. We could probably do close to 2,000 combined. We're still being allocated. Our allocation has gone up about 10%, but that's only a couple hundred doses. It's not a lot of vaccine. Usually we get allocated 1 to 2 trays, which amounts to about 2,270 doses, about 2,300 doses of first dose vaccine. And then for every first dose that we give, we get a comparable or complement second dose vaccine. So there's, at least now, there's always going to be a second dose available for the individuals. The first dose is kind of limited due to the allocations.